All right, the clock is ticking and the pressure is building for House Republicans as the fight over federal spending may result in a full-blown government shutdown. Leaders are preparing for what House Speaker John Boehner calls a, quote, whale of a fight.
On the debt limit, we're going to introduce a plan that ties important spending cuts and pro-growth reforms to a debt limit increase. Now, the president says, I'm not going to negotiate. Well, I'm sorry, but it just doesn't work that way. We're not going to ignore Washington's spending problem.
Speaker Boehner also emphasized that he has no interest in seeing a government shutdown, but if Congress can't get some sort of resolution in place, it's looking more likely that it could happen. Joining us right now from Capitol Hill, Republican Congresswoman Marsha Blackburn. Representative Blackburn, good to have you here. You've been at the forefront of this budget fight. What resolution do you want to see in place to combat our country's rising debt load?
Well, when it comes to the debt fight, which is going to be fight number 2, right now we're in the CR fight and waiting on the Senate and looking forward to hearing back from them. But on the debt ceiling fight, I think that there are some things that we want to see. First of all, as the Speaker rightly said, some substantial spending cuts. Now, for members like me who are always trying to cut back on what the federal government spends, I would love for our federal agencies to do what the House of Representatives has done and cut their budget by about 20%. Those are the steps that we have taken. Every federal agency owes it to the taxpayer to do the same thing. Likewise, we need to do some stabilizations of Medicare and Social Security and some reforms in entitlements. Medicaid is the largest. We took a vote on food stamp reforms last week. Those are what our constituents are telling us that they want to see done. They also want us to do 4 things when it comes to Obamacare, and as your polling shows, it's tremendously unpopular with the American people. What they want us to do is delay it, defund it, repeal it, and replace it. People say it's not workable. It's too expensive to afford. Hospitals are firing staff. They're closing doors. Medical device companies are going into a holding pattern. All of this is bad for the healthcare consumer, and we know it. So,
and yet we've got exchanges that are expected to begin in less than a week. So is this realistic to be able to say, you know, delay, defund, repeal, replace?
I think it is. I think it is, because look at what is happening with some of the exchanges. You're already hearing about data breaches. You're hearing about problems with the calculator that's supposed to help people figure out what their subsidy is. This early rollout has pointed out problem after problem after problem. I think that's why you're beginning to hear some of our Democrat colleagues, whether they're in the House or the Senate, beginning to say a delay may be a good idea. And of course, in the House, my legislation that does delay for 1 full year everything,
what
Obamacare.
Do you think, Representative, what do you think the real cost of health care is? I mean, the White House estimates $3K per person annually. What do you say?
Well, you look at the estimates that are coming out on this. You're looking at healthcare cost increasing about $7,500 for a family of 4. Now, health insurance was supposed to go down $2,500 per family. The president is off. The White House is off in their numbers a little bit there. You can take my state of Tennessee, where before the exchanges, or currently, an individual, a 27-year-old non-smoking male, could buy health insurance for $41. With the advent of the Obamacare exchanges, that goes up to $114. Those are per month numbers.
That needs the health care, or someone maybe of another age group, might they be able to get a better rate? Or do you think it's going up across the board for everyone?
Well, actually, what we are seeing happen when you talk about the elderly, our Medicare and our dual eligibles, Medicare, Medicaid enrollees, what you've seen is about a $600 billion cut in Medicare services that are taking place in order to stand up and offset the cost of Obamacare, and we had a very interesting hearing with Mr. Elmendorf from CBO today over in the Budget Committee on that issue, looking at these offsets. And what we are seeing is that access is more difficult. Options for our seniors are more limited. They are definitely feeling this cramp down. They're beginning to hear they may not get certain procedures.
Representative Blackburn, even if this is all absolutely correct, and we'll give you the benefit of the doubt, let's say absolutely everything you're saying is correct. The fact is, the House Republicans are still, in effect, holding hostage the continuing spending resolution as well as the debt ceiling to something that is far more complicated than can be settled in 3 days. So how do we actually do this in a reasonable manner?
You know what? We've done our work here in Senate to the Senate with the CR, and we have been inviting the president. We have extended open hands to him. We have invited him to come and negotiate with us, and it is so frustrating to hear that he is not going to negotiate on the debt ceiling. You can go look at 17 times throughout history of this nation. Important reforms were tied to debt ceilings, and I think that it is a disservice to the American people. And
well, then
really
why are you doing it, Representative Blackburn? Why are you doing it?
We're not doing it. The president is the one who's not coming to negotiate with us. And
well, he would say the same. He would say the same of you, ma'am. He would say the same of you, ma'am.
We have invited him to come and work with us on the debt ceiling and have been very disappointed that he has time to try to meet with Putin and try to meet with other countries and spend time with the UN, but there's no time to even, you know, sit down with us. We are willing to sit down and work with them and have been very disappointed to hear him say, not our words, his words, that he will not negotiate.
Well, are you prepared for a shutdown if that's where this leads?
We would hope that the president would not keep pushing for a shutdown. I understand, you know, that they would want it because they get control of the checkbook. We're fully aware of that. But House Republicans have been sending ideas, good ideas, solid ideas. We're the ones that have passed a budget every year so that we wouldn't be in this continuing resolution spot. We tried to work with the Senate this year on a budget, and they wanted everybody to agree to a tax increase in order to begin working on a budget. And we're saying, come sit down with us and, you know, let's see what we can do. Our focus at the end of the day is how do we preserve freedom, free people, free markets? How do we repeal and replace Obamacare? How do we make certain that we are going to be able to keep...
There's a lot on your plate. Indeed. Unfortunately, yes, Representative, we are out of time, but thank you very much for joining us.
Absolutely. Anytime. Thank you.
Thanks, Adam.